Tuberculosis, or TB, remains a major global health threat, even in our age of medical breakthroughs. Millions are diagnosed every year, and it's still one of the top infectious killers worldwide. But here's the good news. TB is curable. With the right knowledge, early detection, and proper treatment, we can defeat this disease. Understanding TB, how it spreads, its symptoms, and how to treat it, is the first step. This video will guide you through the essentials: what TB is, how it's diagnosed, and how it's treated. By staying informed, you can protect yourself and your community. TB is tough, but we know how to beat it. Let's get started. Tuberculosis is caused by Mycobacterium tuberculosis bacteria, which most often attack the lungs. TB spreads through the air. When someone with active TB coughs, sneezes, or even talks, they release bacteria into the air. Breathing in these germs can lead to infection, especially after prolonged exposure in enclosed spaces. TB isn't spread by touch, food, or sharing objects. Most people get infected from close, regular contact with someone who has untreated, active TB. Good ventilation helps reduce the risk of airborne transmission. Once inhaled, the bacteria may be contained by your immune system, or they may start to multiply. People with weakened immune systems are at higher risk for developing active TB. Understanding how TB spreads is key to stopping it. TB can exist in two forms: latent and active. In latent TB, the bacteria are present but inactive, no symptoms, and you can't spread it. But if your immune system weakens, latent TB can become active. Active TB means the bacteria are multiplying, causing symptoms and making you contagious. Treating latent TB, especially in high-risk people, can prevent it from becoming active. Active TB requires immediate treatment to protect both the patient and those around them. The difference between latent and active TB guides how doctors diagnose and treat the disease. You can test positive for TB exposure without being sick. But if you have symptoms, it's critical to act fast. Early treatment saves lives. Recognizing active TB early is crucial. The most common symptom is a cough lasting 3 weeks or more. Other signs include coughing up blood or sputum, chest pain, fatigue, fever, night sweats, weight loss, and loss of appetite. These symptoms develop slowly but worsen over time. Don't ignore persistent cough or unexplained weight loss. If you notice several of these symptoms, see a doctor right away. Early diagnosis leads to better outcomes. TB is treatable, but only if you act quickly. Don't wait, get checked. Doctors start with your medical history, symptoms, and a physical exam. If TB is suspected, they'll order a skin test or blood test to check for infection. A positive test means you've been exposed, but further tests, like a chest X-ray and sputum analysis, determine if it's active. Sputum samples confirm the diagnosis by detecting TB bacteria. If you have active TB, treatment involves several antibiotics taken for at least 6 months. It's vital to take every dose as prescribed. Stopping early can lead to drug-resistant TB. Drug-resistant TB is much harder to treat and more dangerous. Completing treatment not only cures you, but also prevents the spread to others. Follow your doctor's instructions closely. TB is curable with the right care. Finishing your full course of antibiotics is the key to curing TB. Rest and good nutrition help your body recover. If you're contagious, stay home and avoid close contact until your doctor says it's safe. Cover your mouth when coughing or sneezing, and keep rooms well ventilated. Attend all follow-up appointments so your progress can be monitored. Report any medication side effects to your doctor. Don't stop treatment on your own. Most people who complete treatment recover fully and return to normal life. TB is treatable and curable, but only if you act. If you have symptoms, get tested. If you're diagnosed, start and finish your treatment. You have the power to beat TB and protect your community.